Good morning, everybody. If I could ask you to move closer to the podium, I won't bite. Everybody can move up. We have a wonderful celebration today. I would like to welcome everybody here today, especially all those from CIBC, and particularly Dave Goulard. As I said, particularly Dave Goulard, who's the District VP for London for CIBC. I could recognize Dave by the massive check he had walking down the hall there, so great to see him. I would also like to acknowledge London Health Sciences Centre Vice President of Cancer Services and Regional VP for Cancer Care Ontario, Neil Johnson, who's here as well. Neil, there's Neil. And along with the director of the postgraduate training program in medical oncology and a medical oncologist with LRCP, Dr. Kailia Potvin. Dr. Potvin? Why not? For those of you who don't know me, I'm Jim Cassidy. I'm chair of the London Health Sciences Foundation. We're here today to celebrate the generosity of CIBC, their support of cancer patients and their families at London Health Sciences Centre. CIBC is here to make a wonderful announcement in support of healthcare in our community. So I would like to ask Dave Goulard, District VP, London, to come forward and make that announcement.
Well, thank you very much, Jim. On behalf of CIBC, I am absolutely honored to be here today to announce our support of the London Health Sciences Centre. At CIBC, we are committed to causes that matter to our clients, employees, and communities. With a focus on kids, cures, and community, our goal is to make a difference through our corporate donations, sponsorships, and the volunteer spirit of our employees. When talking about cures, cancer is very important to us at CIBC because it affects so many Canadians, including our colleagues, clients, and loved ones. This is why CIBC is committed to working with organizations that support research and services for people affected by cancer, as well as with programs focused on prevention, early detection, and treatment, and ultimately finding a cure. We applaud London Health Sciences Centre for making cancer care a prominent part of the care services it offers to individuals. To the doctors, nurses, and healthcare professionals here today, we commend you for your hard work and commitment to your patients. You are an inspiration to all of us. So on behalf of myself, my colleagues here today, thank you for coming. We are proud to be supporting you here today. So can I ask maybe Jim Cassidy, Neil Johnson, and Dr. Potvin to please come up and join me at the podium. So, on this note, it is my pleasure to present this check to the London Health Sciences Centre for $500,000, representing our support to the Access Cancer Therapies Now Fund.
So I don't know how you top that, but I have the next privilege of speaking to you. Good morning, everyone. My name is Neil Johnson, Vice President of Cancer Services here at London Health Sciences Centre and a Regional VP of Cancer Services with Cancer Care Ontario. It's overwhelming. CIBC, thank you so much for your generosity on behalf of our hospital, our providers, our foundation, but most of all, on behalf of our patients. This generous gift is going to make a huge difference to the patients that we serve. And you don't underestimate the power of what you've just done, so thank you. I want to make a few comments on behalf of our organization and our cancer program to give you a little bit of a sense of what we're doing. I mean, this gift today is a perfect example of London Health Sciences Centre vision of exceptional experiences, extraordinary people, and engaging partnerships. We want our patients and our community to have exceptional care here at our hospital, and we have great people, many of whom are here as our cancer program nurses and physicians and other health professionals and administrative staff. We have people like Kylie Potvin are here who are exceptional clinicians and researchers who drive improving care and research for our patients. But sometimes just that skill and dedication, that passion and innovative thinking is not enough. There are times like this when we actually need partners in our community, donors like CIBC, who are part of our community, who are committed to giving back to us, who are committed to making their communities better. And their actions exemplify the engaging partnerships that enhance patient care. Donations, like this one today, are no longer nice to have for healthcare providers and hospitals, but they're absolutely essential if we are going to advance and enhance our current standards of healthcare. So it makes a huge difference. Now at London Health Sciences Centre, we're proud of our legacy of providing excellent care across Ontario and actually across Canada. In addition, donors like CIBC allow us to raise the bar in priority areas to make sure that we're world leaders and have the right technologies to support our patients, and as well the right research and education materials. But it must also be noted that gifts like that received from CIBC today benefit our patients first and foremost, and that's the business we're in, is serving our patients. Let me take you for a few minutes to talk about the London Regional Cancer Program and some of the innovative things that we're doing. At the London Regional Cancer Program, and in conjunction with our research arm, the Lawson Health Research Institute, we're dedicated to treating individual patients as much as we are in defeating cancer. We are leaders in translational research methods, where discoveries at the research lab bench are quickly translated into new treatments or used to modify existing treatments delivered at the patient's bedside, and then where clinical observations from the bedside can be quickly transferred back to the lab for further study and advancements. We're able to lead in the field of cancer research because we have donor support for outstanding research facilities like the Gerald C. Baines Center for Translational Cancer Research. As well as outstanding donor support for individual research projects, donors make many unique and important initiatives that positively affect our patients across the region and patients worldwide who benefit from the results of our research and innovations. We have many projects underway in our 13 different disease sites or areas of cancer treatment that will affect how we approach patient treatments using methods like surgery, radiation therapy, and chemotherapy. Some of these projects include the first definitive trial to measure the efficacy of transoral robotic-assisted surgery for certain head and neck cancers compared to radiation therapy. We also have been working with personalized medicine, our personalized medicine expert, Dr. Richard Kim, to optimize the delivery of tamoxifen by personalizing its use for important breast cancer treatments based on the unique DNA profile of each individual patient. As a pharmacist, that's really exciting stuff for me. And important for our patients. And we're maximizing the effectiveness of all of our treatments by the research that we're doing. Personalized medicine holds the great promise of giving the right individualized dose at the right time for each individual patient. And it's important that the same philosophy now makes our Act Now Fund so critically important. Cancer can be and can have a devastating effect on families. Patients may not be able to work, resulting in substantial financial hardships. Additionally, the costs associated with treatments can be substantial. The Act Now Fund, which is really spearheaded and pioneered by Kylie Potvin to help patients during this time of financial need. This is part of London Regional Cancer Program's overall patient assistance program, and the Act Now Fund will help relieve some of that financial burden for patients today as they seek the best cancer and supportive therapies for their disease. Today's gift from CIBC is a huge boost. It says in my notes a big boost, but I'll say a huge boost to individual patient care. And it will help ensure that the vital financial resource is available when the situations arise. So on behalf of our oncologists, our patients, our nurses, all of our staff in the cancer program, we want to thank CIBC once again for their generosity. Please thank them. And now I'm going to turn the podium over to Dr. Kylie Potvin, who is really who you want to hear from today, not for me as a hospital administrator. Dr. Potvin sees the impact of cancer on the front line every day with the patients that she treats. And through our discussions, as I've come into the program and got to know her, I know that she's passionate about this subject. She's passionate about what she does as medical oncologist and the patients that she serves. She is an oncologist, she's an educator, she's director of our postgraduate training program for medical oncology, and she's there to not only treat patients, but drive research, drive the Act Now Fund, and also educate our clinicians for the future. So I'll invite Kylie now to say a few words.
So if I can get through this without tearing up, that will be a success. I'm a marshmallow. So thank you so much, everybody, for being here. I use other people's words because sometimes I don't think of them. So Sir Winston Churchill said, "We make a living by what we get. We make a life by what we give." And today is just remarkable, and it is joyous. Many of you who are aware of this fund and who have helped me are aware of how it started. So the real catalyst for this was a young woman. She was in her early 30s. She had a 10-month-old baby, and she presented with an exceptionally rare form of breast cancer that we don't see often. And I worked with an amazing group of colleagues, surgeons, radiation oncologists, pharmacists, nurses, and we spent almost a year watching this woman fight this disease, watching her family support her, and watched it rip through every standard treatment that we use. And as she came to the end of things, she couldn't hold her baby because of the effect the cancer was having on her body. She really couldn't do much of anything, and she was an inpatient in our hospital. And there was a treatment that I wanted to try for her. It's a new targeted drug. We are making amazing advances. And it's not funded for her situation because our government does everything they can, but we cannot fund every drug for every situation. We lobbied, we wrote letters, we called. We had people working for weeks trying to find a way to get money so I could try this treatment. I wasn't going to save her life, but my hope was I could get the cancer under control so she could hold her son and she could be at home. She died the day her family managed to come in with enough money for a single dose of the treatment. And so I sat on that for 2 years. And it impacted me. And finally, one day, I just thought, what am I doing? You know what? You have to start somewhere. So I have been fortunate to work with the foundation and to work with an amazing group of people from our community who have become friends. And we started this idea 2 years ago. Why can't we get a pot of money to try to have funds to pay for treatments for patients who need them when they can't afford them? So that's how it started. And then through a lot of thoughtful conversations with patients, watching day to day where all the unmet needs were, talking to my colleagues, I realized, you know what? We have a bigger impact and a bigger scope for our patient population in the Cancer Center than only trying to cover these rare situations, these unfunded drug situations. There are so many patients that can't even get an anti-nauseant, that can't get support for their white counts. We have immigrants that come into the country on refugee status that need urgent cancer treatment, but they don't have money to pay. They don't have an OHIP number. The visit with the doctor is pretty cheap, but the treatment is not. We have patients who do have drug coverage and there's a treatment they could get, but that $200 a month copay, it's just a little too much. So maybe they'll turn down taking a treatment because they can't afford it. So it became really apparent that there's a lot of opportunity to touch many, many patients in our cancer centers and give them access to what they need, to give them the tools to fight this disease. And so that is what ACT Now is for. It's for our patients. Neil has given you an amazing scope, and some of our researchers are also present here today, and without them, we won't figure out how to treat this disease, so we've got to support our researchers. But we cannot forget our patients on the way. Our patients are here now. They need treatment now. They need those supportive medications now, but not everybody can afford it. And we have a lot of money in our community, and really, you know, when the money isn't there, Jeffrey Simpson, he's an author of the Globe and Mail. He just wrote a policy book and received a big award for, you know, his prescription for our healthcare woes. And he had said, you know, when the money's no longer there, you need brains and you need innovation. And I think he is missing one piece to that. You need heart. And that's what this is about, is heart. It's the generosity from everyone here, This started, the Bell Foundation, the Karamanos family, and the Obsidian Group started by recognizing this a couple of years ago, and they have gotten us off and running. And today, we are here to thank CIBC for that next step. So, again, I'm going to quote from somebody because I'm not particularly good, and I hope I can get through this quote. In the end, though, maybe we must all give up trying to pay back the people in this world who sustain our lives. In the end, maybe it's wiser to surrender before the miraculous scope of human generosity and to just keep saying thank you forever and sincerely for as long as we have. That's Elizabeth Gilbert, who wrote Eat, Pray, Love. So I'm here to say thank you to my patient and her family. Because of her tragedy, she gave me the courage and the inspiration to get up and do something. I say thank you to my friends and my coworkers and the people at the foundation for recognizing and helping support this idea and starting with our small fundraisers and getting the word out to where we are today. I say thank you to Obsidian Group and Karamanos and the Bell Foundation for getting us started and giving us some of those basic funds. And today I'm here to say thank you so much to CIBC. You know, CIBC is creating a legacy for what they're doing in this fight against cancer. They're creating a legacy in driving research, but now they're also creating a legacy in actually helping us in our community, people you and I know and see every day. They're going to help make that treatment better. By this unbelievable and amazing donation, CIBC has taken us from that beginning, and they've just catapulted us into sustainability with this fund. So to CIBC, I am so grateful. To everybody here, thank you for coming. Please get the word of this fund out, because remember, the money that goes into this fund is going back to our community and to our patients, and there is no other cancer center anywhere that is doing this. Thank you, London and CIBC.
Thank you, Dr. Potvin, for your inspirational comments, and I think for having the heart and taking the initiative to develop the fund that's led us to this wonderful gift today, and the position that the fund is in now from where it started. It's just amazing. I would also like to echo Neil's sentiments on what it takes to deliver great care at a hospital. It takes dedicated, committed, brilliant, and caring people, but it also takes resources. Donors like CIBC have made and continue to make a profound difference in the level of care available in our community. That is because it is with donor support that helps provide the most advanced resources, enabling the heroes at our hospitals, those who deliver care, those who research, those who innovate, and those who educate to make the greatest difference possible. It is with this in mind that LHSF has begun a campaign to meet the current and future needs of London Health Sciences Centre. In fact, CIBC's gift is one of the first major donations of this campaign. Their outstanding contribution is an example of the support we need to sustain and to advance the world-leading and medical innovation and care we currently enjoy in London. I want to thank Neil Johnson, Dr. Kailia Potvin, and everybody at London Health Sciences Centre for their dedication to and their care for the families and patients at our hospital and in our whole region. And on behalf of all of us, I would most like to thank CIBC once again for their leadership, their generosity, and their care and concern for patients and their families and our community. Thank you. This concludes the formal portion of today's announcement. I would invite everybody to stay, enjoy some refreshments, and celebrate in this great announcement. Thank you all for your attendance.